I have with us today Ed. He's going to share with us his experience in the Sunrise Wellness Center. Ed's wife was a patient first, and she was doing very well, so Ed decided to get himself checked. Now, Ed, when you first came in, we ran some blood work on you. Do you recall that?
Yes.
And we actually had some very alarming blood work, if you remember. So alarming that we actually had Ed consult with his MD, who felt that we weren't in a crisis situation, but certainly, things needed to be done.
Right.
So we put Ed on a program, and after 3 months, we sent Ed out for blood work. Ed, do you recall what happened when we redid the blood?
Well, everything was vastly improved, and even my MD said that he was shocked how much things had improved, including my diabetes numbers, and the all of they came out excellent. I went from a 7.1 to eventually a 5.6 on that IAC number, or CA.
Yeah, it's called an HbA1c, or an HbA1c. Above 6.2 is type 2 diabetes.
Right.
So once we get it below that, we're not in that danger zone of having type 2 diabetes, needing medication, and dealing with all the sequelae that can happen from having diabetic type problems. So it was really tremendous, the blood work we had. Now, Ed, you've been with us now, I guess, about 5 months, is that correct?
Yeah, a little over 5, yeah.
How much weight have you lost during that time?
41 pounds.
That's awesome. Do you find the diet to be difficult? Is it something you enjoy?
Not at all. Not at all.
Are you eating more food than you used to, or less?
Well, I'm eating better food, but I haven't really cut back. It's not that I'm not eating. I'm eating, 3 meals a day. Sometimes I have a snack at night. The snack at night is no longer potato chips or pretzels, but it's not a problem. I mean, I've given up some things that I probably should have given up a long time ago, like soda. I don't drink any soda. But everything else is pretty much,
right. So the main thing for us was that, you had some pretty alarming blood work, and everything from systemic markers, iron markers, neutrophils, CBC counts that were all off. The blood sugar obviously is really all in normal ranges at this point.
Right.
So what we're doing now is we're trying to continue the care to get the symptomatic changes we're looking for to get your body to express 100% health. So I'd say at this point we're miraculously better, but we're still definitely working on...
Right. I mean, I just noticed day-to-day things, like with my grandchildren, just even getting up out of a chair, losing 40 pounds and just having a little more energy. It makes things so much easier, and when I play with them or take them to wherever, the energy level stays with me, which is a big change.
Yeah, it's quality of life changes when you start to get your health back,
yes,
as opposed to maybe trying to treat a symptom or treat a disease in a certain way. When you change the quality of your health, you also change the quality of your life. So, Ed, your big problems coming to see us were fatigue, sleep difficulties, lower back pain. Now, we know you're doing better in all areas, not perfect yet, but that's our goal at this point, is to try and improve all things. Keep tweaking your supplements, working with the diet, working with the chiropractic care, and we're going to get you as close to 100% as we can.
Well, I'm very confident. I'm thrilled with the results so far, and I expect them to continue that way in the future.
Thanks, Ed.